And welcome to the Dr. Bob Show. You know, most people have heard the word menopause, but sometimes they really don't know what it really means. What symptoms do people really have with menopause? What causes those symptoms? Does it disturb some people worse than others? Does it cause medical problems? We'll be spending most of this show talking about menopause, what causes it, what symptoms occur, and what we can do about it. My guest is Dr. Paige Johnson. Dr. Johnson is a board-certified OB/GYN doctor, and she'll be answering our questions. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about the carotid artery, the artery in your neck that throws blood up to the brain. What happens if things go wrong there? And hoarseness. What are some of the common causes of hoarseness? Why do I get hoarseness every spring? We'll be answering those questions. A lot of information for you. We're talking with Dr. Paige Johnson, board-certified OB/GYN doctor, and we're going to be talking about menopause. Paige, welcome to the Dr. Bob Show.
Thank you so much. It's such a pleasure to be here. I watch your show all the time, and I have to give a quick shout out to my friend Penny, our phlebotomist, who loves your show, watches it religiously, and she's already DVR'd this episode, she told me.
We're just going to have Penny on the show next time.
We need to get Penny on the show. We do, for sure.
So tell me, what is menopause?
Menopause is that transition, just sort of like when we go through puberty, where our bodies go from one hormonal state to another hormonal state. And it is a transition. It can last over several years, but it's where the ovaries are starting to run out of their estrogen and progesterone producing hormones, and they're starting to quiet down. And the reason they do that is because we're kind of ending that childbearing age time period, and they're going into a quieter time period.
So what's the most common age for somebody to have menopause? Is there a common age?
Well, there definitely is. In the United States, most women are through menopause by around age 51. But obviously, since it's a process, some women start it a little bit earlier than others. But after 45, it's fair game.
How do you define menopause? Is it got a definition?
Yeah, the definition is, no periods for 1 year.
So 1 year.
1 year. But the symptoms can start beforehand, and they can last after the menstrual cycles have actually stopped.
So if it starts beforehand, can it start as much as 3 or 4 years before?
Yes, even up to 10 years.
10 years before. So what symptoms begin to evolve? What does a woman experience before she truly gets into menopause?
Well, so a lot of women will start to experience maybe some mild hot flashes or waking up in the middle of the night sort of drenched in sweat. We call those night sweats. And then there are a lot of women who start to experience some vaginal dryness. And then too, with the night sweats comes some sleep interruption. That can also lead to some differences in mood, some moodiness, some irritability, because you're just not getting that good solid, 8 hours of sleep that we recommend so often.
So if you're getting those gradually for 4 years until you go through true menopause, no periods for 12 months, do the symptoms progress? Do they get more and more severe? The night sweats get more and more severe? The sleep disturbances more and more severe? The vaginal dryness more and more severe?
Well, so the hot flashes certainly can escalate, but I'll be honest with you, most of our patients, once they start to experience them, they don't get worse and worse and worse until they stop having periods. A lot of times they'll start to experience those, and it will sort of persist for a short period of time after they've stopped their menstrual cycles. The vaginal dryness, on the other hand, is the one that can start to begin, and that's the one symptom that doesn't typically go away. Once a woman starts to develop some vaginal dryness, whether it be mild or severe, that can worsen over time.
Does vaginal dryness cause main problems with sexual activity or with urinary tract activity?
Well, actually it can do both, because what happens with the vaginal dryness is the tissue actually starts to thin and get what we call atrophic. And so therefore there's less secretions and less lubrication. That can cause problems with painful intercourse or dryness, but then it also causes the tissue around the urethra to shrink and get shorter, and women's urethras are actually pretty short to begin with, so therefore that increases decreases the chances that with intercourse they can have a short transit for that bacteria to cause urinary tract infections.
Medications work for that?
Yes, they do, actually. And it's very small amounts of vaginal estrogen will oftentimes take care of the urinary symptoms and the vaginal symptoms.
It's wonderful that we've got treatment that helps the symptoms that people have, especially when they're going through menopause. I want to go back to hot flashes.
Absolutely.
Tell me about why they occur and what they are really like. You see people, trying to get air on their chest.
Well,
What's
so
going
it's
on?
very classically described as it starts from the chest, goes up the neck onto the face. But I have women that will experience them all over. And it's vasodilation. The blood flow comes close to the skin, and it's just kind of almost like you're exercising for a moment. You actually can sweat. Women actually come to me and they'll say, hey, listen, I was in a meeting the other day, and all of a sudden I turned bright red and I started to sweat under my armpits, and I can't do that. It makes me look like I'm nervous when I'm really not. They last typically a couple of minutes, and then sometimes because of the sweating, women can actually get very cold afterward. That's very different than women who will explain to me, oh, well, I'm just hot all the time, and they're hot for extended periods of time. That's typically a different cause. These are episodes that are defined over minutes and not over hours.
How frequent?
Well, they can be very infrequent or they can be very frequent. And that's the variability. Just like we're all different, that's variable from person to person. I'll say the vast majority of people, though, have milder to moderate symptoms. Those women who experience them 20, 25 times a day, that's pretty unusual. But those are typically women that we're going to need to get some treatment for.
So if somebody is having the hot flashes at a time where the ovaries are sort of fading into the sunset,
Yes.
Then it's hormonal directed, the hot flashes. Is it estrogen, progesterone? What's going on?
Most commonly, it's the decrease in the estrogen, and it's that sort of up and down. You're getting the ovaries are still working some. They may surge at times, and they're starting to come back down to a lower level, but they haven't really quiesced and kind of stopped and slowed to a level where they're going to stay. They're still kind of in this up and down mode.
So if somebody's gone through menopause, 12 months, no periods, do they still have hot flashes?
They can, Dr. Bob, unfortunately. But most women are going to resolve their symptoms over, on average, a 2 to 3 year time period. But as you and I both know in medicine, not everybody reads the rule books and not everybody follows the rules. And we do have a small percentage of patients, it's typically going to be less than 10 to 15%, that can experience symptoms long after they've stopped having periods.
Medications, treatment for hot flashes would be what?
Well, we have actually a lot of different treatment options, and it really kind of depends on the person and her medical history. If women have medical problems, there are some medicines like estrogen and progestins that we wouldn't recommend, like if you've had a heart attack, you've had a stroke, if you have a predisposition to blood clots, or for our patients who have had certain female cancers, in particular breast cancer, they're not going to be great candidates for hormone replacement therapy, which is probably still, even to this day, one of the main therapies that we use just because it works so well.
So if somebody is not a candidate, if somebody has not had strokes, blood clots, breast cancer, they are candidates for hormone replacement therapy.
Absolutely, they are.
How good is that at getting rid of the hot flashes?
It works extremely well. Now, I won't tell my patients that every last single one of their hot flashes will go away because then I get phone calls in the middle of the night, but they do quiet them down quite significantly. And the good thing that we've learned over the years from our scientific studies is that it doesn't take a very large amount, just a small amount. And that's something that we've kind of maybe had some issues with early on. We started with too high a doses. Now we have some very low doses, and women tolerate them very, very well, and they're considered very safe.
So they're good medicines, should be guided by the doctor.
Absolutely.
Flipping away from hot flashes, how about sleep disturbance? That's one of the things that goes on that we mentioned. Why can't people sleep well? What's going on? What do we do for that?
Well, so I have to sort of re-educate my patients when I get them, when they're asking questions about menopause, because everybody has trouble sleeping, wants to blame their hormones. And I hear that quite a bit. And so I have to do a little investigating in my office, because if it's not due to night sweats, if women aren't waking up, throwing the covers off, having a fan, pajamas soaked and feeling that they got to change, then unfortunately it's probably not necessarily a sleep disturbance related to menopausal symptoms. Now, sleep disturbance can cause women to have an increased risk of anxiety and depression because they're not getting good solid sleep. So sometimes the night sweats may have started it, but now we're dealing with an anxiety or depression issue that's interrupting the sleep. They're having a hard time.
Can you help people if they're not getting
can.
good sleep or if they're having anxiety?
Yes, you can.
And that's what we're going to be talking about when we come back. Wow, menopause can really cause a lot of problems, and we've got a lot of answers for you. You want to stay tuned. We're talking with Dr. Paige Johnson, board-certified OB/GYN physician. We've been talking about menopause. We've been spending time talking about hot flashes, why they occur, hot flashes, night sweats in the middle of the night. We've been talking about vaginal dryness. We've been talking about maybe anxiety and some mental changes and sleep disturbance, and that's where we left off. Let's get back to sleep and anxiety.
Well, I think around this time in a woman's life, there are sometimes a lot of other things going on. You know, I saw a patient in the office the other day, and her son is going off to college. So she's now going to be an empty nester, and she's like, I don't know what I'm going to do with all this free time. And then lo and behold, her husband's retiring from his job as well. So
she's
now
in trouble.
She is in trouble. So she's got somebody else to consider. So there's a lot of things going on in a woman's life around this time period too. So I think that for sure you throw in some sleep disturbance due to night sweats, you're not sleeping quite as well, and then you've got some other pressures or maybe outside things interacting with your health. Sometimes that can increase the risk of some depression or anxiety. So the beautiful thing about that is that we as OB/GYNs are really well versed in this time period in a woman's life and being able to tease out whether is it hot flashes or night sweats that are causing your sleep disturbance, or maybe do we have some depression or anxiety, or is there something completely altogether that you need to see your primary care doctor for?
You know, what I like of what you're saying is you're talking about the whole patient.
Absolutely.
You're not just talking about one symptom or one little thing. You've got to bring the whole patient in together to try and figure out what you can do to help their life and to make it better. So if somebody's got sleep disturbance, I just can't sleep. I wake up and I'm hot and I'm nervous and I'm anxious and I can't get to sleep, and if I wake, how do you guide them towards sleep health?
Well, obviously there's some very important things that people can do to help them with their sleep. And we know this because there's a multitude of studies that look at, okay, how do we get to sleep well? But it kind of really depends on what's going on. If I really think somebody's got more night sweats, or they really, really feel like that's what contributes to the sleep problem in the beginning, then if we add something to help with the hot flashes and night sweats, and they stop having those in the middle of the night, they sleep better, then that actually might correct some of the other issues that are having, like fatigue or mental, fogginess during the day. But the flip side of that, if I really feel like somebody's got more anxiety or depression, believe it or not, the depression medications will help hot flashes improve their mood by upregulating their brain receptors, and then we'll get the benefit of both.
So it must be a nice thing to see when somebody is, their menopause, their night sweats, sleep disturbance, driving them crazy, and you can guide things toward better health. Let's talk about the time of menopause in somebody's life. You said somewhere around 50 or 51. There are other changes that go on in menopause that we need to be very aware of. What would those be as far as heart and bone?
Well, for sure, this is a time where a lot of women, when they stop producing estrogen, their bones are going to go through a change. They're going to start to get a little bit thinner because they're losing that estrogen. Every woman is a little bit different too, based on her family history and her medical history. Does she have thyroid problems? Has she been low thyroid? We're concerned about whether or not they're going to lose bone rapidly. If I've got somebody who smokes, that obviously is a risk factor for thinner bones. So those are women I'm going to recommend doing a DEXA or a bone scan on a little bit earlier. But we also know too that women don't settle into their lowest bone mass probably for about 4 to 5 years after they stop having menstrual cycles. So somewhere in that time period after they stop having their menstrual cycles, and about 5 years out, is when we're really going to be looking to do those bone scans.
So during that period of time, do we think they're losing calcium out of the bones too? Do we give those patients calcium?
Well, we want to make sure that they're getting enough calcium in their diet. But there's been a lot of press over calcium. Can you take too much? How do you get it in your body? And we know it's absorbed the best if you can get it through your food. But I don't know about you. I don't eat a ton of food with bones in it anymore. I've got patients now that are making bone broth, and that's got a lot higher calcium in it. But things like your spinach and your broccoli, they've got a lot less calcium in it. You got to eat a lot of it to get the recommended daily allowance, which is about 1,200 milligrams. So I will look at my patient's diet. Are they doing really well with their dairy intake? Do they get good nutrition? And then where are their other sources of calcium? If they're just not getting enough, then I might recommend they supplement.
It's a very important part of women's health. How about cardiovascular? What happens to the heart and the blood vessels at menopause?
Well, we start to catch up to men when it comes to cardiovascular disease risks. So I'm going to look at a woman's exercise routine and what her nutrition is like, what her weight is like, and I'm going to gently encourage, if she doesn't have the greatest health habits, that this is a really important time of prevention so that we can encourage some walking and some weight loss if we need to do that. Also, if she has any symptoms of cardiovascular disease, which for women is a little bit more difficult because they don't have traditional, chest pain that radiates to their shoulder. Sometimes they have things that we consider just like an upset stomach or heartburn. So we definitely want to make sure that we're encouraging them on the signs and symptoms of cardiovascular disease, in addition to some habits that are good for them that they can follow up with their primary care doctor if they need to.
Yeah, it's so important because women don't do as well after heart attacks, after menopause, and they don't do as good with heart failure. And so they really are a bigger risk than men are. And sometimes we don't pay as much attention. Is that correct?
I think so. I think sometimes it's just easier to, because they're not classic symptoms, to not always recognize. So you got to have a higher suspicion. I start encouraging my ladies, or even doing blood work on them to make sure their cholesterol is okay, checking blood pressures, and then too, just looking to see what their family history is, whether or not they're going to need some cardiovascular prevention.
Does menopause always go away?
Well, all women stop having periods at some point.
Yeah. So that's menopause.
That's menopause.
Then the symptoms.
The symptoms, for the vast majority of women, yes, they will. And my job is to help transition women who are bothered by their symptoms. And I think that's a big thing a lot of patients don't understand. If you're having some hot flashes or night sweats, but they're not interfering with your life, then it's okay to just to live with them. And as a matter of fact, a lot of my patients do nowadays. But if they're really interrupting your life, if they're increasing your stress or your anxiety because you're not getting good sleep, or it's interrupting your marriage because you can't enjoy sexual relations with your husband. I mean, those are opportunities that we have to help offer women different treatments.
It must really be a real smiling, happy sort of sensation to be able to see people that are having problems and know that there's something that you can do for them on almost anything that goes on. So women that have gone through menopause see their doctor. How often should they go for a routine check?
Well, that's a little bit controversial, but if you ask an OBGYN, we still honestly believe that women need to have a GYN health maintenance exam once a year.
And they have it once a year. What are you looking for? They've gone through menopause. They're not going to have children anymore. What are you looking for?
Well, so we're looking obviously to assess risk for breast cancer. I still do an exam. I still talk to women about their breasts. I'll always continually evaluating for family history. There's obviously women will experience other symptoms, sometimes not just vaginal dryness, but maybe some vaginal itching. The vulvar area and the outside of the vagina are at risk for developing cancers, and nobody else is looking down there, unfortunately. Also, too, we want to make sure that women understand. You'd be surprised how many women will have a little bit of bleeding or a little bit of blood, and they don't really know where it came from, or they think maybe that it came vaginally, but that is a sign that it could be a cancer, and we definitely want to make sure that we're evaluating for that. The other thing I like for patients to be evaluated for is just to make sure that they're not having any abdominal bloating. Ovarian cancer symptoms are extremely subtle, and sometimes women don't have them until it's well advanced. So just having a pelvic exam, or at least talking to someone about symptoms of weight change, abdominal bloating, increase in abdominal girth in their abdomen, all of those things are very important. And sometimes you don't think about them because they happen slow or subtly unless somebody asks you.
That's right. And asking is the important thing because, oh yeah, I've got bloating, or oh yeah, I've got some discomfort. Oh yeah, I haven't had my mammogram in 2 years, or things like that, that you can help them and guide them through this time of life. Paige, you're a wonderful teacher. I don't know that I've ever had a guest who's had so much information, just ready to give it to help other people like you do. It's been a real thrill for me to have you on the show.
Oh, it's been an absolute pleasure, Dr. Bob. Thank you so much.
I hope you'll come back again.
Anytime.
If you're going through symptoms of menopause, know that there's treatment. If you've got hot flashes, if you've got sleep disturbance, if you've got maybe bone loss, if you've got anxiety, depression, vaginal dryness, know that there's treatment for those things. Don't hide them. See your OBGYN doctor, get that exam, and get those problems taken care of. And now, a lot of information for you. We're going to be talking about the carotid artery, the main blood vessel that sends blood to your brain, and the brain needs blood, and hoarseness. Why do I get hoarseness every spring or every fall or every winter? We'll be talking and giving you answers for those. I want to thank Dr. Paige Johnson. Wonderful discussion on menopause. Know that if you've got symptoms, they can be treated and you can get relief. Now, question from you, the viewer, that I think will be important to your health. Question number one, Dr. Bob, what is the carotid artery and what happens when things go bad with it? Well, it's obvious that this person has had something wrong with their carotid artery. There are two big arteries in the neck that carry blood up to the brain. And so we want both of those arteries to be doing a good job. They're susceptible, like any other blood vessel in the body, to getting hardening of the arteries, cholesterol deposition, therefore narrowing of the artery, therefore diminished blood flow going up to the brain. Since we have two carotid arteries, the blood supply to the brain is made where if one goes bad, the other one more or less takes over with circulation right at the base of the brain, an area we call the circle of Willis. But back to the carotid arteries, it's a classic area for somebody to have sudden occlusion, to develop strokes, to have transient ischemic attacks where suddenly you just pass out like you're having a stroke, but it goes away quickly. If you're having symptoms of a stroke, remember, if sudden blindness, if there's facial slurring, speech slurring, weakness of an arm, 911, call your doctor. You have to get to the emergency room quickly. So those carotid arteries, if the doctor listens to the neck, he may hear a bruit. That's a murmur as the blood is trying to get through that hardening of the artery of the carotid artery. If he does hear a bruit, a murmur, then he can get special tests to see how much of that blood vessel is narrowed, how dangerous that is, what needs to be done. And it can be that you need to do either lifestyle changes and medicines, or it can be surgical procedures where you do what we call endarterectomy, and that's where they make a little incision in the neck and they can go and they can actually take out that clot, or they can put some stents in. So know if you can feel your neck, never feel both sides at the same time. Never feel both sides at the same time. Why? Because then you could really be cutting off the blood supply to your brain. But if you feel your neck and you feel a little buzzing noise that's there every time your heart beats, that's a bruit. Know there's probably narrowing. Talk that over with your doctor and get on the road to good health. Question number two, Dr. Bob. I get hoarse every spring. What's the reason? Well, hoarseness is a common thing to happen. Everybody, before they're going to give a big talk, gets hoarse. Or before they've got to do something, they get hoarse. It occurs at the most difficult times. There are certain causes of hoarseness, though, that are very, very common. Number one, we call little nodules on the vocal cord. Yellers nodules are preacher's nodules, people that use their voice a lot, people that are talking, people that are yelling, teachers that may be yelling or teaching to large audiences. They can get irritation of the vocal cords, and the irritation of the vocal cords can cause swelling, irregularity, and hoarseness. There is a nerve, the recurrent laryngeal nerve, on the backside of the thyroid. If somebody has thyroid surgery, if that nerve is nipped, then you may have hoarseness after the surgery. It may be that you have an upper respiratory infection. That's the most common cause of hoarseness. The infection causes redness around the vocal cords. Those vocal cords don't approximate well, and if they don't approximate well, then the air that goes through that causes sound causes us to be hoarse. And usually we just need some treatment and some voice rest for a period of 7 to 10 days, and all of that will go away. Hoarseness can be to allergies, it can be to drainage, it can be due to reflux from people with esophageal reflux disease. The reflux can actually come up and acid can deposit itself right where the vocal cords are and cause irritation there. So there's lots of causes of hoarseness. If you have hoarseness that persists, it's something that must be seen by a physician. Persistent hoarseness can be a sign of cancer. So somebody simply looks down at the vocal cord and they can tell you what's going on. If you've got hoarseness, know that it's probably secondary to infection or you've been using your voice too much. And a little bit of voice rest will usually get rid of things. Treating your allergies or treating your reflux disease. But talk it over with your doctor, especially if it's persistent, because you don't want to have cancer of the vocal cord that's not treated. They can treat it well. Like most cancers now, we're doing better and better at treating cancers. My hat's off to cancer treating doctors. It's all the time that we have this show. I hope you've enjoyed it as much as I have. Remember, the 4 things that we like. Number 1 is exercise. Can't tell you about how important exercise it is. Just get your tennis shoes out and go for a walk. Start doing that 3, 4, 5 times a week, 5, 6, 7 times a week. Make it where it's a habit, a part of your life, where you're exercising 30 minutes with a brisk walk. If you want, you can jog, you can ride bicycles, you can do other type of activity, but be sure that you're exercising on a regular basis. Eat properly. Know that your breakfast is your most important meal. Look at the size of the food you're going to be eating. If you want to lose some weight, then cut down on the volume of the food that you eat, and you'll find that, hey, you'll stay full, but you won't gain so much weight. 7.5 hours of sleep. There's so much to talk about with the sleep. You have to know how to go to sleep. You have to know how to set the environment to sleep with. And if you snore, you need to know that sleep apnea can cause health problems. So now, 4th, the most important thing in the Dr. Bob Show is laughter in your life. Laugh a lot, giggle a lot, and you'll stay healthy.